So welcome everyone. I'm Lamona Chanda. I'm one of the co-founders of the Global Activist Network. And today we'll discuss a very important topic. We'll try to understand the economy of health and care and its challenges. It's a broad topic. It's a complex topic, and we'll try to have uh, a basic understanding of what are we dealing with currently. And to do so, we have an esteemed guest with us to discuss this topic. But before I introduce her, let me cover a few important points. We are recording this session and we will be sharing the recording through our social media channels, so you have a chance to listen to it at a later stage. And please make sure to follow us on Facebook, Instagram, Twitter, LinkedIn, and YouTube. It will give you a chance to follow our content and the great sessions that we host on a regular basis. At the end of the session, we will give you a chance to ask questions to our speaker. And so hold your questions or feel free to put them on the chat box. And please keep yourself on mute. I will mute myself after I've asked a question. So those are our housekeeping points. So without further delay, let me introduce our guest speaker. She's Venus Dadirai Mushininga. I hope I have pronounced it right, Venus. She is from Zimbabwe, and I'll cover a little bit, and this is just one aspect of her profile. Feel free to learn more about her background, but I'll just say a little bit about her. She's a public health consultant with expertise in health systems strengthening, non-communicable diseases, global health security, health financing, and universal health coverage. She's the co-president of the Women in Global Health Zimbabwe chapter, with extensive experience in advocating for equity and better access to holistic quality healthcare, including access to medicines, and in developing global health policies. Venus has held leadership roles both nationally and internationally on board of directors, professional associations, executive management roles in several private limited companies, professional bodies, cancer care organizations. She has worked with multiple stakeholders, both at the national level, regional level, global level, to ensure access to healthcare services. Her goal is to ensure that the goals of universal health coverage are realized in whatever role she plays, and that these goals are attained. The voices of women and patients are heard and addressed. Venus is currently an independent public health consultant board member of the European Society for Oncology, Pharmacy, board member and founder of the Zimbabwe Society of Oncology Pharmacy. She's also an active member of the Pandemic Preparedness Response Working Group for Women in Global Health, and has interests in international health regulations, Financial Intermediary Fund for COVID-19, One Health, and the Pandemic Treaty. So I'm already short of breath covering all these achievements, all these brilliant roles that you occupy. And I cannot imagine the kind of expertise one would require, Venus. So we are very fortunate to have you here today. Welcome. So why don't we start by finding out a little bit about yourself and what inspired you to pursue this line of work?
All right. Thank you, Lemona. Thank you, everyone, for having me. Yes. My apologies if you hear some music. I'm at an interesting place. But what inspired me to do this work? I think I started off my career in oncology after I graduated from pharmacy school. And one of the things I actually realized was the challenges the cancer patient had accessing medicines and the costs which they faced. So that led me to actually shape my career in such a way that I needed to actually look at the disparities in access to care. And then I realized that one of the factors was the issue of resources, the economics of healthcare, where we've got resources, but we've got limited resources, but we've got abundant need. So that is how I ended up in the area of we're trying to understand the economy of health and its challenges. So the main driver was to actually work towards universal health coverage, minimize out-of-pocket expenditure, increase access, and remove barriers to access to medicines and healthcare technologies. So yeah, that's what I can say about that. Thank you.
Thank you so much. So, from your profile, we see that there's so many aspects of healthcare. If we were to really simplify it, like we see it as um, almost like consumers of healthcare services, we see that, healthcare in today's economy is inequitable and inaccessible by many, if not the majority of the population, especially in low and middle income countries. So, what, in your view, are the main challenges?
Thank you so much for that question. I think the main challenges I see is the way health systems are designed. We have got health systems that have moved away from being patient-centric. We've lost the goal of what a healthcare system should be. And actually, what has actually exacerbated this is treating health as a commodity versus it being a human right. So we've got more priorities looking at pursuit of profit versus provision of quality healthcare. And we've got this conflict of priorities, and also this obviously affects the way policies are crafted, where we've got unsustainable, which leads to unsustainable programming and lack of building capacity, especially for low medium countries, to actually mobilize resources and strengthen their domestic financing mechanisms. And looking at the way the economy is, where we've got low medium income countries being debt ridden, most of them are so deep in debt. It'll take generations to dig themselves out of the hole. So in that case, then health becomes less of a priority. And the other challenge would be the emerging health threats that the low medium income countries face. So we have a double burden of disease. We are fighting communicable diseases, non-communicable diseases, and this actually leads it makes it very difficult to have equitable health systems as our resources are stretched. And then there is also issues of governance affecting how the healthcare system, how the health economics is set up. So I would say those are the challenges I can think of at the moment. Thank you.
Thank you, Venus. So you have covered a number of focuses in your response, and you've already touched on low and middle income countries. If we were to accept the fact that, there is a lack of funding, there are all these issues, do you see any other sort of striking difference between developed countries and low and middle income countries in terms of challenges?
Yes, there are actually differences and similarities, but mostly the challenges that are faced by the high income countries and low income countries are similar. But it's just that in low medium income countries, there has not been that drive to build resilience in the systems. And we've got long-standing differences due to the political situations that have happened in the past. The disparities have actually been on have been around for a long time. So you notice even the infrastructure, the economic capacity of low medium income countries is far behind compared to high income countries. And then if you look at health resources in low medium income countries, there's actually very limited resources that go to health financing. The WHO Declaration says 15% of GDP should go towards health, but very few, if any, I'm not even sure, but it's very difficult for countries to get to this 15%. So most of the patients end up looking at um, out-of-pocket payments, and health insurance is not very much developed, public health or even private health insurance. And as I mentioned before, the high burden of diseases is actually something that is very unique to low medium income countries because of other factors. If you look at the social determinants of health, the low medium income countries are actually more at a disadvantage. The impact is more negative in the setting of low medium income countries. And we also have challenges with the health workforce. We already, in the low medium countries, there's already limited health workforce, but now we've got the brain drain where everyone is moving. And if you look after COVID, I think during COVID, I was in the COVID response, and the numbers of people who left to go to higher income countries or to other countries was very high. And this has strained healthcare systems. And also the issue of access to essential medicines and technology. I think if you've been following what has been happening post-COVID-19, where it actually made it so glaringly visible that there was issues around this. And the other issue is health inequalities and barriers to access. There are various of them, looking at cultural considerations, how the Africans, the low medium income country populations are socialized and all that, which actually puts them more at a disadvantage. And also, we have issues with health information systems. Data-driven health economies actually perform better. So we've got weak health information systems, and this actually affects how we plan, how we budget, how we allocate resources, and in low medium income countries. And the other thing, I spoke of governance before, so it's looking at governance and coordination. We've got a lot of fragmented healthcare systems because mostly I've observed, because we are partner funded, the partner comes with different partners come with different priorities. It's difficult to integrate interventions and maximize the efficient use of resources. So that's a huge challenge that many African economies and countries face. And of course, we cannot talk without talking about the political instability. When we have elections, things go back, every cycle. I think it's every 5 years in most countries. So you notice we have these challenges, and generally looking at health system resilience, most systems are not designed to be resilient. So these are the challenges. And in terms of, like I've mentioned before, the burdens that the low medium income countries have are actually higher because they've got a higher burden of disease, higher burden of higher rates of mortality, yet the resources are never enough. So yeah, and the costs are high as well. So that's what I can say about this. Thank you.
Thank you, Venus. There's quite a bit of, information there um, for us to look at. So our next question for you, and feel free to frame it looking at global healthcare structure, or if you wanted to focus specifically on Zimbabwe and use your experience to answer this, what factors primarily in your opinion, influence the economy of health and care, and whether it will be equitable and accessible? What are the basic, factors that we need to look at?
I think we need to look at our health financing models. Are they sustainable? Are they public health? Are they patient-centric? Are they reducing the out-of-pocket allowance? And this is very critical because if we don't have financing models that are sustainable, then we tend to fail in delivery of healthcare services and even making it accessible. And we also look, as I mentioned before, we also need to look at government investment in health. How can we make governments accountable for the investments they make in health? How can we make their change and advocate for their change, for a change in how they prioritize health? And actually look at, because when governments sit together, for example, they make the WHO declaration for 15% of budget allocated to health, they agree, but the implementation becomes a challenge. So that government investment of health needs to be strengthened. And then we're also looking at generally the economic development. I spoke of poverty, all right? The debt, and how it becomes a cycle where we've got huge debts on other countries, and also looking at the GDP levels and poverty levels. So in a country, we might actually have different levels of economic development in different socioeconomic classes in different areas. And this actually leads to lack of equity in access. And I also spoke of the health infrastructure, which actually does talk closely to how planning is done, urban planning, how cities are planned, how countries are planned, looking at the infrastructure that's in urban versus rural. There is equipment you can't even use in a rural setting because it needs a lot of electricity, which is all channeled towards urban settings. So automatically we've created a lack of equity just in how we've structured. And then there's also the issue of technological capacity. So we're looking at maybe the technology itself being accessible and the expertise that can deliver this technology being more in a certain area or in certain spaces. And the other issue which I've mentioned is the health workforce. We're looking at the availability and also just looking at the training and retention. So we might train, but retention is key, because then we have these skills that are within and the experience, and people can be able to continue to provide care. And I spoke of health technology and innovation. At what pace are we moving to absorb the new technologies? Are they efficient for our systems? Is it necessary to get new equipment or to actually maintain what you already have? So that really affects the economy of healthcare and whether it's equitable. And I mentioned the issue of social determinants of health. So you're looking at income, education, gender equity issues, race and ethnicity. This is the universal factors that affect people in every setting. And then we're looking at geography and accessibility, just how a country is, how your geography is. Mountainous area, you already have a barrier. People cannot move to the healthcare facility. Or you're living in Iceland, you can't get there. Antarctica, you can't get there easily. So the geography that has a factor. And then I mentioned cultural and social norms, what the community believes. You might have everything in place, but if people have certain beliefs, they've got certain ways of doing things, they will not come to the health facility. I think lots of countries I know are struggling with, for example, vaccination, because people believe it's not part of their culture to get vaccinated. There are myths, there are misconceptions, and the society believes that. So that those are some of the factors. And then I also spoke of issues of insurance. To what extent are there facilities for healthcare to be accessible for free? Is it financed by the government? Is it financed through taxes? So all those are factors that influence whether people can access can access healthcare equitably. Thank you.
Thank you, Venus. And just a clarifying question from about this issue. In your view, because you have listed a number of things, and from what I understood, we have to depend on the policies and the approach adopted by the governments of each country. But is there anything in your view that the international agencies or international bodies can do to make this basically enhance health equity?
Of course, I think there is because, for example, I will give an example of what's happening with the pandemic treaty, right? So I think during COVID, we realized, oh my goodness, if we have another pandemic, we're going to have a problem because if the other side of the world does not access vaccines, they don't access the diagnostics, this pandemic is going to stay on with us. We will not be able to win. So instruments such as the pandemic treaty are actually an example of what the world at global level can do to actually look at mitigating these disparities. So, but now the challenge now, because I think one of the sticking issues was with the pandemic treaty was whether we have legally binding, non-legally binding. So if it's legally binding, who's going to enforce it? How do we have mechanisms where we can actually have people being held accountable and being penalized for not being able to actually follow through with what nations have agreed, countries have agreed in the pandemic treaty. So those kind of mechanisms, for example, we also have the tobacco treaty as well, tobacco control treaty as well. So those are the kind of mechanisms that can actually help, but only when I think they are co-created by the governments themselves, though the ones we expect to implement them. So they take time to be finalized and all that. But I think it is critical for that holistic engagement. And also at that level, I think if we're going to have to involve people with lived experiences, bring them to the table and have more women sitting at that table because they are the majority of healthcare workers, they are the caregivers, they're like the spine of the society, and they have experiences that can actually help. So actually having even the people affected in the healthcare system, the people living with lived experiences, the marginalized populations, the women sitting at the decision making table when those policies are made actually would actually go a long way in making them easier to implement at the grassroots level. Thank you.
Thank you, Venus. You mentioned about the pandemic. We have all been through very different, challenges, and we have experienced um, very different experiences based on where you are based in the world, in which country.
Yes.
So my next question is, and we have seen basically there wasn't equity in terms of how vaccines were accessible or how they were distributed. So what we would like to know from you is that does the demand and supply of healthcare services and products play a role in determining how equitable um, healthcare is?
Of course, definitely. Economics is basically looking at demand and supply and how we can match demand to the supply. So, for example, there are factors that are on the supply side, for example, availability of services and the resources. Then the demand is what the people need or want. So, if there's an imbalance between these two, we have inequalities coming out. For example, if you're looking at demand, you look at what the population needs. Different populations in different areas need different items. For example, in the pandemic, the African population needed the vaccine. They were at increased risk because the health systems were already weak. They were at increased risk of dying from COVID because of lack of protection. So that's demand. And then also even the ability to pay. And we also look at factors like health literacy and the issues to do with supply. I think we've mentioned most of them, but I'll look at the issues of distribution of vaccines, like you said. So those supply factors actually contribute as well. And then this interaction, what is critical is the interaction between this demand and the supply as well. So if the economy and the policies that are there actually make it, for example, difficult to meet demand of a certain commodity, of a certain health service, then the equity issues become very apparent. Equitable access just is thrown out of the window. And then we also look at the issue of if you're looking maybe at digital technologies, right? You know, the way they make it easier to access medicines, telemedicines. A person doesn't have to try to drive or to move from where they are. But because of the infrastructure that's not in place, the demand is there. There's great demand, but the supply, the supply side is a problem because connectivity is actually a problem. So you notice that this supply demand issue is multifactorial, affected by so many factors, influenced by so many factors. So it is critical to look at this when coming up with policies or interventions to see both sides and see if we can balance this out. And I think we can address the issues of equity. Thank you.
Absolutely. Um, so I mean this I'm going to ask you a very difficult question. And the reason I say this is difficult is because it's a question that requires a long answer probably, but I'll still ask you. Uh, how can we enhance the equity of health and care?
Okay, I think I'll try to make the answer as short as possible. I think, from my perspective, having patient-centric models for delivery of healthcare services actually helps. Because if all of us put the patient at the center, we forget all the other political, socio-economical factors, and we focus on what we need the patient to get. Because any of us can be a patient at one time. So it will actually help to look at those kind of models, I think. And also looking at the issues of legally binding frameworks, enforcement, finding a solution, unlocking the key on how we can enforce this, because they are beautiful documents, great policies. They are solutions we've come up with. So it's important to be able to be accountable and actually work on the governance issues of those. And like I said before, sustainable financing models. I'm a fan of sustainable domestic financing models, because I think as countries know what they need, they know their priorities, and it is very important for them to play an active role in financing their health systems. And also, if the people are paying for their own care, like if you're going to mobilize um, resources locally, even the ownership is there. It's different from how you expand external funding versus what you've raised as a nation, or like maybe if you look in the household, how you use the money that you bring up, you put together as a household is different. It goes far than money someone just gives you and said, oh, go have a drink, you go have a drink. But if it's money you've raised, you look at the priorities, you look at exactly what you need, and you want to meet those needs first. And the other issue is building capacity. Of course, we talk about all these things, financing models, planning, budgeting, universal health coverage. It's to build capacity of individuals and people in the right places to be able to implement this. And of course, I cannot answer without talking about gender responsive health systems, because I think we look at issues of equal pay, and then looking at elimination of issues to do with access. If we attend to gender disparities and we put gender responsive systems, we actually can enhance the equity of health and care. So when I speak of gender, I'm not speaking of women only. I'm talking of men as well. We need them to be there, to be on the table. We need to consider their needs as well. So yeah, that's my short answer for that one. I hope I did it justice. Thank you.
Thank you so much. Once again, there is a lot of gold nuggets that we need to take away and, research more on. But one thing, and I'm just going to catch you off guard. I didn't think of asking you this question, but I'm going to ask just in case you have an answer. You refer to sustainable financing models. Can you, at the top of your head, can you think of any sort of like successful case studies, or is it something that we still need to think of and come up with a solution?
Okay. Yeah, I think in terms of sustainable financing models, I'll talk of what happened with the HIV response. if you see how the HIV response has been structured and how people have been able to access medicines, commodities for years and years, because of how it was structured, we've got governments contributing, we've got the national, international community contributing. We are negotiating prices with suppliers and manufacturers. We are monitoring our implementation and all that. So, and we are evaluating as we go. We've got targets that you're checking. So this is a very successful model, which I believe if we tap into it, if you tap into the lessons learned, we'll be able to achieve our goal of universal health coverage and equitable access to healthcare. Thank you.
I really apologize, but I will ask another question that I didn't plan on asking you, but I still have to. And that's because I'm only asking this because we all have had people in our families, we all have had loved ones who have had cancer, who've lost people. And this seems to be the scariest disease out there. Why aren't we still able to sort of come up with either like a treatment or a structure that, where patients feel that I'm secured, I can go through sort of like a secure course of treatment, or even what we achieved for the HIV example that you shared. Do you think that the same can be done for cancer treatment as well?
You asked me this ironically. I'm just coming from the World Cancer Congress, and I think it's one of the areas which we've been trying to come up to say, what do we do? So just to mention, I think on the 16th of September, there was actually a meeting where we were looking at meaningful engagement of people living with cancer, people affected by cancer. So this is one of the initiatives that's there to say, how do we co-create solutions with those affected by cancer? Where are we missing it? So this is ongoing work. And I think traditionally there's been very limited financing for non-communicable diseases, including cancer. So now if you see the global financing mechanisms, there's actually that trend now to move away. For example, in the global Cycle 7 grant writing I was involved in Zimbabwe, we actually looked at how we can integrate NCD financing into HIV financing. How can we finance both? Now the initiatives for cervical cancer integration. So I think the solution for cancer is not looking out for new resources, but looking at what we already have. The capacity is already there. The laboratory capacity is built by the lab, and actually see how we can leverage on this and actually integrated models of care to actually deliver this, because it's the same patient we are serving. Like I say, I keep going to patient centric. It's the same patient who's the HIV positive who's got cervical cancer or is at higher risk of getting cervical cancer or Kaposi's sarcoma. So it is very critical that we change across the continuum of financing, the value chain, how we look at delivery of care, look at integrated ways, integrated every level. We can policy, finance, service delivery, and monitoring and evaluation. Thank you.
Thank you so much for that. So now you have already mentioned the importance that women play when it comes to healthcare services. And from an outsider's perspective, because I'm not a practicing healthcare professional, but when I look at, um, any sort of healthcare setting, at the ground level, I see that the most difficult tasks are carried by women. In a family setting, I come from a traditional society, care responsibilities lie on the women. Taking all these things into consideration, and but I will also add that when I look at the leadership roles, even the women are carrying most of the burden of care responsibilities. We see less women making decisions high up there. So taking all these things into consideration, how can we ensure that we adopt a feminist approach towards our healthcare systems?
All right. I think you've already answered that question. I think we need to actually appreciate the role women play in healthcare. For example, at the moment, we've got women being 75% of the workforce, but only 25% are in leadership positions. They sit at the decision-making tables. So it is important for us to recognize these imbalances and appreciate that we need the perspectives of women and bring them to the policy making table. You know, there are gender policies that are everywhere where we are saying 50%, 50% representation in certain boards. For example, in Zimbabwe, we've made great strides towards that, where we've got 50% representation. But not only representation, but have women who are knowledgeable sitting at those tables, capacitate them to be able to make meaningful contributions at those tables. And we also look, I think one of the areas we need to consider is also looking at gender disaggregated data. Because if we have that, for example, it took a while for us to get gender disaggregated data for COVID-19, when we actually realized, oh my goodness, it's most women who are the frontline healthcare workers. It's mostly women who are taking care of people who are not well. And having gender disaggregated data actually helps us at the end to shape our policies to address the needs of according to a gender lens. And also one of the major things is gender mainstreaming. So I think one of the issues that has been a problem, I think, not a problem as such, one of the drivers, the things that we've been advocating for in the pandemic treaty is the issue of mention of gender and equity, the language including that. So it's very important to mainstream gender into policy programming at all levels of the healthcare system, HRH policies, whatever it is, so that at the end of the day, we can have that feminist approach to gender. It's not saying that men are not important. We bring in the men also to assist, to advocate for the women, because they have mothers, they have daughters, and they see those disparities affecting them. So it will be very important to have that holistic approach and looking at using research, actually, have advocacy that is grounded in research, and actually looking at how we can increase that feminist lens for the healthcare system. Thank you.
Thank you, Venus. Now, I would like to ask you two questions from this topic that I didn't plan on asking you. One is, from your experience, do you feel that there's reluctance in giving spots to women at decision making? Have you experienced something like that when you are exploring, leadership roles? And also, the second question is, from your experience, do you see that there is an honest sort of effort to adopt feminist approaches in healthcare, or is it still something that we are working on?
I'll answer the second question first. I think it is something we are working on. But what I've observed is in instances where we've got male allies, it's actually easier to have the feminist approach being implemented. So I think we need to form alliances with the males who are in decision-making positions to actually help us to push for this. And then in terms of, have I experienced this? Yes, definitely I have. I think in my previous role, the question was, I was a technical advisor, why was this role given to a woman? Couldn't we find a woman? Couldn't we find a man to be sitting in that chair? And these are things that are not said in the corridors. These are things that are said in your face, without shame, without remorse. And when that happens, I then tend to look at this people saying this and trust, and also it's coming from both the men and the women, unfortunately. And this goes down to societal issues, how we are socialized. So it's something we need to go back to and look at community engagement, catch them young, sensitize children on gender issues from when they start preschool, so that at the end of the day, they then tend to appreciate this. Yeah, so that's my response to that. Thank you.
Thank you. And I'm sure that we have a lot to learn from these experiences because this is how, we'll raise awareness of and we'll figure out what's actually happening. So from my personal experience, I will say that I work at the grassroots level in developing countries. A lot of my work happens in Bangladesh, which has areas where you don't have healthcare access at all. So drawing from that experience, I mean, I see that there is an imbalance when it comes to accessibility of healthcare by women and girls, um, especially in low and middle income countries. And within those countries, it gets worse when they don't belong to a higher socioeconomic group. So then when it comes to their daily needs like cost and accessibility of something like sanitary napkins, can be a challenge. Then there are secondary things, and I think you have already touched on these things like social stigmas. They're associated with menstruation and all that. And then in South Asia, in my region, something that's quite common is femicide. Like uh, there is a preference for a male, like a boy child, a male child, because that's considered sort of like the name bearer of the family. So what happens in reality is that women and girls don't get the kind of support or the kind of nourishment that they require. Taking into considerations like really rural areas as such, what action can we take to ensure that we can build a sort of like a robust healthcare system that really protects and nourishes healthy girls?
All right. Thank you. I think, like I mentioned before, I spoke of meaningful engagement of people with lived experience. So I think what we need to do is to work with the community. We need to respect cultural context and recognizing the positive and negative aspects and trying as much to augment the positives. Because now, if we're going to come with a policy top-down approach, and these people do not understand why we are saying, well, femicide is not necessary or female genital mutilation, it becomes a problem. So it is important if we want to be able to change society, because this is changing behavior, this is changing what people believe in, and we need to engage because and most societies are patriarchal, so putting the men in the forefront of these initiatives actually, I think, will help. And having men as champions for women will actually accelerate creating safe systems, safe environments for males. Yes, that's for the young girls. Yes, thank you.
Thank you, Venus. So moving on, um, we have already talked about COVID-19 and some of its challenges, but I'll still ask you this. Uh, the economic crisis, the global economic crisis, and followed by the pandemic. And then we see more and more uh, like natural disasters, which are getting worse by the years. It's creating a lot of burden on the healthcare industry. And if we take COVID-19's impact, that single-handedly has already created like a backlog and a crisis at, I think, at the country level for every single country in the world. How can we overcome this?
I think it is important to realize that we cannot continue implementing health interventions and planning for health as if it's business as usual. But we need to realize that at every step of the way, whatever resource we get, we need to structure our interventions, our planning, whatever we do, such that we are building resilience in the system as we go. It all goes down to pandemic preparedness, response, and recovery. So to say, as we've learned from COVID, how do we take on the lessons? How do we change? the way we've been doing things to ensure that we have robust healthcare systems, and also just looking at how we can have, like I spoke of, integrated health service delivery systems. So how can we maximize on the resources that are available, and how can we integrate and streamline our healthcare interventions so that we can actually be able to as we go, as we work. I think one of the things that was common, I think one of my supervisors during the COVID response will say, this is a boat we are building as we go. So the health system, economy, and everything is we are building as we go. But where we've built, let's make sure it's strong enough to withstand any shocks. That is my response to that. Thank you.
Thank you so much, Venus. And so, my last question for you before we take any questions from our audience, and we have already discussed it, but if we had to sort of summarize, or if you wanted to add anything else, what are we missing in your view, in the economy of health and care? I know, we have talked about it, but if you were to add anything new, or if you wanted to sort of like give us a summary of your top recommendations.
All right, I think I'll just give a summary. I think what we are missing is, like I mentioned before, is not recognizing health as a commodity, realizing that health is not a commodity, but it is a right we are entitled to simply by being humans. So I think this requires for everyone, everywhere where they are, to have a paradigm shift in mindset and realize that the sustainability of economies um, actually comes from harnessing the resources that we have and strengthening what we have and building on it, and looking at domestic solutions, patient-centric models, ensuring the voices of the communities are there, and that equity can only be achieved if women are at the highest decision-making tables. And I think that's what I would say, and that we need a health systems thinking approach where we've got a patient-centric view to how we supply healthcare. Thank you.
Thank you so much. Those were great insights from you. I think it's time for us to take any questions from our audience. And we have already received a question from Taibo. Taibo is one of us from the Global Activist Network. Taibo asked, given the rising health risks from climate-related impacts, such as air pollution, extreme weather, what are some key lifestyle changes or preventive measures that individuals can adopt to maintain good health in the long term?
All right, thank you so much. I think we look at lifestyle changes, lifestyle modifications. So these are individual changes that people would need to make. For example, you have to increase physical activity, look at the diets. So there's what is called the WHO-based bias, and we're looking at smoking, tobacco, and alcohol intake. So it has actually been noted that those four actually contribute to the majority of the common risk factors for most of the non-communicable diseases. And they actually make people more susceptible to communicable diseases as well because of the effect on the immune system. So looking at the WHO-based bias and trying to leave them and adopt them is actually something we could look at. And if you're talking about climate change, we're looking at funding resilient, for example, agricultural practices. It goes back to nutrition. Nutrition is critical for health. So if we've got droughts, we've got floods, and people are losing, they're not accessing nutrition, we have a problem. So it goes back also to holistic approach in terms of taking on these interventions, a multi-sectorial approach as we want to have healthier lives. Thank you.
Thank you, Venus. We received another question from Prudence. Prudence is also one of us from the Global Activist Network. Prudence asked, how can individuals reduce their exposure to chemical pollutants through personal care product choices?
All right. I think for personal care product choices, yeah, it's a challenge that is everywhere. But it will be important, I think, to look at obtaining those products from formal sources, not looking at buying things from the streets, because sometimes cheap is expensive at the end of the day. So instead of buying a cream, from a questionable outlet, you'd rather walk into a supermarket or a pharmacy and buy it. So usually for those, the supply chain is what is critical, and from where the consumer accesses the product, because from other areas there's actually controls. For example, I'm a pharmacist, and I know the majority of pharmacists will be selling you quality products. So the retail chain, how the product gets to the final consumer is very important. So consumers should actually be wary of where they get their products, and where even ask where, and looking at increasing the capacity of consumer councils that advocate for protection of consumers will actually be critical as well. And awareness for the individuals and what is harmful and what is not. Thank you.
Thank you so much, Venus. I'm just going to give a few seconds to our audience to see if there are any more questions for you. Do we have any more questions for Venus before we conclude our session? Okay, we received a question from Gertrude. Gertrude asked, in your opinion, how can governments prioritize healthcare on their national agenda, especially in Africa? Do you think we have learned any lessons from COVID-19?
Yes, I think from COVID-19, yes, we have learned lessons. But the challenge is implementing the solutions that we've seen work at scale, and financing those make those interventions and making them sustainable. So I think the issue of how we can help governments prioritize, I think through engagement of people with lived experience, through frameworks that hold governments accountable, capacitating patient groups, civil society organizations to advocate. And I think people hear more, listen more if they're listening from a person with lived experience. So that their involvement, their engagement is very important for vulnerable populations, talking to the government, creating those platforms so that, and also presenting our advocacy as research is very critical. Having facts backing our advocacy is very, very critical, so that they really realize that this is not just speaking, but this is things that are happening. They are factual and they are backed by evidence. So capacitating in research and strategic advocacy would actually go a long way. Thank you.
Any more questions for Venus before we conclude our session? And we have a request for you from Gertrude again. Do you have any sort of concluding remarks, any last words for health experts and for the audience who joined us tonight?
All right. Thank you. I think my last word, my last remark is that we should stop treating health as a commodity, but treat it as a right that every human being is supposed to have access to, so that we can move away from siloed approaches and look at patient-centric, holistic approaches that are integrated, that maximize on the resources that we have, and take into account the local context that people are dealing with, and make sure as we build resilient systems. As we operate, we are building resilience into the systems so that they are sustainable and can withstand shocks. So those are my parting words. Thank you.
Thank you so much, Venus. And that concludes all the questions that we had for you. I think we covered a lot And given, that we come from very different backgrounds, I think our role now is to take away all the insights that you shared and learn and educate us more about these things and how we each one of us can contribute and make an equitable healthcare system in whichever location we are based in. But we would like to thank you so much for making time. We are aware that you went to Geneva for a conference, and it's not easy to make time, but we'd like to thank you for making time for us and sharing your expertise, your views with us. um, and yes, thank you so much to our audience who joined. We did get, and some audience from our social media channels as well. Everyone will get a chance to watch your insights at a later stage when we share the recordings. And before I conclude the session, my parting message on behalf of the Global Activist Network. Thank you, Venus, once again. And would like to highlight our focus, which is to spotlight change makers who are creating social impact, who come from marginalized backgrounds, but they're still doing great work. So if you are aware of any such change makers, please do nominate through our nomination form so that you can spotlight their work. But thank you, everyone, for joining.
Thank you.
And yeah, please follow our socials as well. We have the links to our socials in the chat. So if you're not already following us, please do follow us. We'll really appreciate it. Thank you.